It is Sunday, May 9th, and I will be inserting a Foley catheter on a male patient and removing the Foley catheter. First thing I need to do is confirm the order for the correct patient in the chart, which I've done. I enter the room, perform hand hygiene. I gather my equipment, enter the room, perform hand hygiene. Hello, Mr. Johnson. I'm here to insert your Foley catheter, provide privacy. Check the patient's armband. You tell me your name and date of birth. Okay, that all checks out. Have the patient lay down, spread their legs slightly apart, perform hand hygiene, put on clean gloves. Expose the area and perform perineal care. I can do this or delegate it to the CNA as well. After cleaning perineal area, take off my gloves and perform hand hygiene. Next, I get my sterile kit. And I open this up, only touching the outer inch of it. I put on sterile gloves and put this, making sure that that the sterile field never leaves my eyesight. Put this on the patient's chest. Touch the inside of the cuff with my glove, and then I touch the outside of the cuff with my sterile glove. Gloves are on. That can stay where it is. I will clean that up later. This is a sterile drape or sterile pad that I can put underneath the patient, but the patient already has a water absorbent chuck underneath them, so there's no need for this. This is also an optional drape that can go over the patient. I don't need to use that. So now I'm getting my gear out. I have my iodine, which I'll open and cover over the cotton swabs. That can go in the trash. I'm keeping my hands above my waist level. I have my normal saline solution to inflate the balloon. I will connect that to the balloon. And then I have my lubricant, which I will put about a quarter to a half of it in here and save the rest. And I will put the catheter in the loop here. Next, I will, with my non-dominant hand, I will grasp the penis and hold it upwards and clean with the cotton swabs provided, with the tongs I have, from the tip of the meatus down to where my gloves are. I need to do this at least 3 times. I'm doing this in a circular motion, spiraling motion downward. There's 5 cotton swabs, so I will use all of them. Okay, next I will take the catheter and fan fold it into my hand. Let the patient know that I'm going to be inserting it. Oh, I'll not be doing that next. I will first insert the rest of the lubricant into the urethra. We need to let the patient know that I will be doing that. Feel a little pressure. Insert the rest of the lubricant. And now I will get catheter fan, fold it, and insert it. Let the patient know that I will be inserting this. They're going to feel a little pressure. So I insert the catheter. All the way to the bifurcation. And once I get to the bifurcation, I need to hold it here and insert the normal saline to inflate the balloon. I'm watching the patient for any signs of discomfort. And then I need to keep it depressed and then pull that out. And then I attach the tubing to the patient's leg. And I place the bag below the patient, securely on the bed. And I'm watching the flow of urine and noting the color, and I need to empty after it's done its, I need to wait for it to completely empty for one time and note the color, odor, clarity, and amount. Take my gloves off, perform hand hygiene, and clean everything up. Okay, so now I'm going to remove the catheter. So first thing I need to, I come in, perform hand hygiene. Hello, Mr. Johnson, I'm here to take your catheter out, okay? I need to have with me 10 ml empty syringe, washcloth, or some sort of rag, and gloves, which are in the room, and then the cylinder to empty the catheter bag. So I enter the room. Hello, Mr. Johnson, perform hand hygiene. I'm here to take your catheter out. You need to check your ID bracelet. I also need to confirm the order for the correct patient before entering. You tell me your name and date of birth. Okay, that checks. First thing I need to do is empty the catheter, or empty the Foley bag completely. Note the color, odor, clarity, and amount. Dispose of that. Come back, perform hand hygiene. And we're ready to remove the catheter. So I have the patient lay down, spread their legs slightly. I will put this underneath the area to catch any dribble that might happen. Need to check on here how much is in there. On the inflating port here, it says 10 mLs. So there should be 10 ml. I need to make sure that I get 10 mLs out. And when I see this tube collapse, right here. I know that I've gotten everything out, so I've got my 10 mLs. And now I'm going to let the patient know that we're going to take a few deep breaths. It's just going to be a little uncomfortable. And we'll pull it out. So pull it out, and I hold it up so that nothing drips out. Fan fold it in. Put my glove over it. And I can dispose of this in the trash. Using my gloved hand and the towel that I left behind, I can clean up the area. Dispose of that in the dirty linens. Take my dirty glove off, perform hand hygiene, cover the patient back up, tell him he did a good job. Oh, I also need to tell him he needs to void within the next 6 hours, and what he should expect might be slight burning sensation when they urinate. Also, I need to be monitoring, and the patient as well, for urinary retention. Also, at least for the first, it should be all the time, but at least for the first urination, they need to urinate in a urinal or a hat. But that should be done all the time to assess eyes and nose. And that is all.